Hi guys, welcome back to my channel. If this is your first time here, welcome. Please don't make it your last. Kindly hit the subscribe button and turn on the notification bell so you'll be the first to get notified whenever I drop a new video. And if you are a returning subscriber, welcome back to the channel and thank you for tuning in. So in today's video, we want to talk about men with breasts. Yes, I know all men basically have breasts, but want to talk about men with big breasts that you will see that it's not normal. When you see them, you'll be like, man, are you dragging or you're fighting over bra with your wife or what? Okay, now it is medically called gynecomastia. So in today's video, I'll be talking about the many causes and solutions to gynecomastia. So if that sounds like what you want to know, let's go to school. Gynecomastia is a condition which comes from underlying health issues, hormonal problem, side effects of some certain drugs, and also age, which results in the enlargement of the breast tissue in male. However, gynecomastia can be difficult and complicated to know where it is coming from. So I'll be telling you some common causes of gynecomastia. The first one is hormonal changes. Men and women produce estrogen and testosterone or androgen, which is responsible for maintaining the normal bodily function related to sex organs. However, estrogen is for the female, while testosterone or androgen is for the male. The male have little quantity of estrogen in them, which serves some particular functions, but estrogen does not stop their own hormone. If this estrogen is now available in excessive volume, you can come down with gynecomastia, because estrogen is particularly for the normal bodily function of male related to sex organs. The second one is medication. Some certain medication can cause gynecomastia, and when I say some certain medication can cause gynecomastia, I mean their side effects. It's not that when you take a particular drug you just have gynecomastia. No, it is as a result of their side effects. So drugs like antidepressants, drugs used in treating anxiety, drugs used in treating cancer, ulcer drug, heart failure drugs, antihypertensive, used in treating prostate problem, gastric medications, and also drugs used in treating male infertility. All these drugs have some side effects, but some might not be affected. You as a male can take a certain ulcer drugs and you will not be affected by some side effects. Side effects is not only one. We have many side effects of some certain drugs, and because the drug has a side effect does not mean you are going to experience all those side effects. The side effect of drug can be headache, stomach pain, vomiting, maybe frequent urination, and you might just experience headache alone. So if you are so fortunate, you might not experience gynecomastia or any severe side effects. You can just experience some slight one, which is like headache or weakness of the body. Weakness of the body is not even really simple, okay? And the next one is alcohol and drugs. Now, when I mean drugs, I don't mean medications. I mean drugs like amphetamine, marijuana, anabolic steroids, heroin. I mean hard drugs, yeah. And long or short-term use of alcohol can also lead to gynecomastia. It does not mean if you take alcohol, you automatically have gynecomastia, but alcohol can cause gynecomastia. So if you are taking alcohol, watch it, okay? Aside the fact that these drugs can cause gynecomastia, these drugs even deteriorate your health, so it's not good for your body. If you have to take this drug, it will be prescribed to you by a medical practitioner. You're not the one to just think or just wake up one day and you'll be like, okay, I want to take heroin, I want to take marijuana, okay? But all these drugs has been they've been abused and they cause severe problems to the health. Example is gynecomastia. Some health conditions can also cause gynecomastia, like hypergonadism, hyperthyroidism, Klinefelter syndrome, malnutrition, liver failure, kidney failure, hormonal changes associated with aging, and also tumor in the testes. Another thing that can cause gynecomastia is herbal products. Some derivatives of herbal products, I mean some derivatives like some ingredients present in herbal products can cause gynecomastia when they are used for oils, when they are used for body creams, shampoos, soap, and you use them on your body. It can result in gynecomastia. Another cause of gynecomastia is age. Men between the age of 50 to 69 years old and boys in their puberty stage are subjected to gynecomastia because of the hormonal changes. And if you can remember, the first thing I told you that causes gynecomastia is the hormonal changes, where there is hormonal imbalance between estrogen and androgen. So hormonal changes can cause gynecomastia in male during their puberty stage and also between the age of 50 to 69. Sometimes people with obesity can develop enlarged breast tissue, and this is as a result of the excessive fatty tissue present in their body. This condition is known as pseudo-gynecomastia and not ordinary gynecomastia in this case. Now let's talk about the symptoms. How do you know you have gynecomastia, or how do you know you are subjected to gynecomastia? Okay, the first one is physical swelling and tenderness of the breasts. Men who suffer from gynecomastia will always have swollen breast gland tissue. In many cases, this increase in the breast gland size will cause tenderness of the breast and sometimes pain. Second symptoms is hard lump under the nipple. When you take your hand to your chest and you move your nipple from the right to the left and from the left to the right, if you feel a small lump or maybe a hard bulge under your nipple, it is a primary sign of gynecomastia. When you are under medications like the antidepressants, ulcer drugs, cancer drugs, and the drugs I mentioned earlier, you are more subjected to gynecomastia because, you know, I said some side effects result in gynecomastia. This does not mean you automatically have gynecomastia. This means you can experience gynecomastia as a side effect of some certain medications. Also, alcohol and drugs. When you're taking alcohol and using hard drugs, you are more subjected to gynecomastia because these drugs play a very important role in your health, and before it can be prescribed to you, definitely you should be facing a problem concerning your health. Now you're not facing any problem, but because you just want to feel, you want to feel in with the most high, you want to chill with the most high, you want to be high, you take all these drugs, and at the end of the day you come down with gynecomastia. Also, age. If you are in your puberty stage, or if you are between the age of 50 to 69, you might be feeling like this breast is becoming big. Calm down, okay? Relax. It is just as a result of hormonal changes. For men who are infertile that are on hormone supplements for their infertility issues, it can, let me say, the probability is like 2 or, let me say 2 over 10, maybe 3 over 10 or 4 over 10, because there will be alteration of hormone in their body. Prevention and treatment, I'm going to divide them into 2. That is the pharmacological and non-pharmacological. Concerning the prevention, the pharmacological one that I can say it cannot be prevented is hormonal changes. Now, hormonal changes cannot be prevented because if you are between the age of 50 to 69, or if you're in your puberty stage, there will definitely be an hormone imbalance, and you can't prevent that. Now, the non-pharmacological one has to do with you. There is no need to chill with the Most High. If you want to chill with the Most High, wait till God will call you, that will call you to glory. Okay, you can prevent this by not taking hard drugs and alcohol. Yeah, the pharmacological treatment is tell your medical practitioner, tell your doctor some signs and symptoms you are experiencing when you are taking some drugs, so they can switch. It's not that I'm going to stop it. If a particular ulcer drug is causing gynecomastia, we have many ulcer drugs that are even different classes that can be switched to. So you should tell your medical practitioner, you should complain to a doctor so that they can help you switch that drug. Then the second one that is non-pharmacological treatment is you should withdraw from anything that you know is causing gynecomastia in you, because you cannot be taking hard drugs and they'll still be giving you drugs for gynecomastia while you are still taking that hard drugs. you cannot be taking alcohol and they'll be giving you drugs to treat gynecomastia, and crazily you will still be using it with alcohol. These things cannot, okay, they are not going to work, or they will even be antagonizing each other. And the last one under treatment is surgery. Yeah, some men choose to go under the knife to just remove the breast tissue at once and makes the breast smaller. Okay, that's basically all for this video. I hope you all enjoy and I hope it was educative. Please give this video a thumbs up, comment, share, and please subscribe to my channel. It means a lot to me. Follow me on all my social media accounts. The links are in the description box. Get in touch with all my previous videos. They'll be displayed on the screen and they'll be right here. And see you in my next one. Bye.